you can see that there's more than just the testis in here. So the testis takes up most of the space. And then there's this kind of J-shaped or cup or ladle-shaped structure right here that seems to be cupping the testis. And that's the epididymis. So I'm going to try and show you where I pin the epididymis. Get it in there all the way. There's the epididymis. I pulled it away from the testis. That's the epididymis. The epididymis is where sperm go to mature, and they wait there for ejaculation. If they die before ejaculation, then the male body just digests them and recycles their parts. Okay, then the epididymis gets real skinny right here and joins in with a bunch of other stuff. And where it gets skinny, that's the vas deferens. And then it joins in with the testicular artery, the testicular vein, the lymphatic vessel, and the nerve. That forms this big cord that we call the spermatic cord. And you will be responsible for knowing the 5 parts of the spermatic cord. I think they're listed on your sheet. Is that correct? A stands for artery, V stands for vein, N stands for nerve, L stands for lymphatic, and VD stands for vas deferens. Now this is going to go up and transverse through the layers of the abdominal wall, and you guys remember those layers. So now we're inside of the cat, and then the vas deferens splits away. Uh-oh, Miss Stunky broke it. Let's see if I still have it over here. Yeah, I have it over here. There's the vas deferens over here. But this one is severed. Sorry, I didn't mean to. That's a vasectomy the hard way. Yeah.
Where exactly would be the lymphatic one?
Sorry?
Where exactly would be the lymphatic?
I can't pin it, but I can ask it. Because we have learned everywhere that we have vascular everywhere we have capillaries. That's right. Okay, so from this view, I'm pulling on the urinary bladder. Oh, well, I was rough with this guy. I cut its urethra too. Darn it. So he's got this urethra. Now, your cat's got a really nice prostate. I can visually see it and I can feel it. Look how big that is. See that swollen area right there? So if you have gloves on, Lolo does, yeah, you'll feel right in there. You should feel a bump, almost like a little rock. I don't know. It's big. Oh, wow. That's the prostate gland.
He's an old man, he didn't get his exam.
Yeah. And it's going to be just the urethra all the way till we exit out of the abdominal cavity. And I can tell I did because of the bone. See, it's Mr. Bigglesworth III, right? He's got real nice pubis bone here that I cut, and you can see it in. And then now we're outside of the body. So this would be the shaft of the penis. But in reality, it's just the urethra continuing. And then this is glans penis, or what your patients would call the head of the penis. And then unlike humans, you can see little hard bumps of hair on it. And that's what he uses during intercourse to stimulate the vagina of the female to ovulate. She does not ovulate until intercourse. Okay, now I'm pulling back the skin, and you can tell this skin was protecting the penis of Mr. Bigglesworth, and I pulled this skin back so that you could see it, and we call this skin prepuce, or your patients may call it foreskin. And this is what is removed in the process we call circumcision. You've heard of that process. How'd that go? Okay? Okay, good.
Professor Sankey, I have a question. Like, when are we going to be